Hey guys, it's Dr. Hub. Today we look at myomectomy. So here there's a retained uterus and hence preserves the childbearing function. So myomectomy, it retains the uterus and it preserves the childbearing functions. So childbearing functions is present. The effective for the heavy menstrual bleeding and the pelvic pressure. So it is effective in terms of the heavy menstrual bleeding, HMB, as well as the pelvic pressure. What is the disadvantage? The disadvantage is that the formation of a new clones of abnormal myocytes. So it forms new clones of abnormal myocytes. So in terms of the hysteroscopic myomectomy, it is a procedure of choice for removing the intracavitary myomas. So in terms of the intracavitary myomas, what is present? In such cases, the hysteroscopic myomectomy is done. So hysteroscopic myomectomy, this is done. Then there is also the vaginal myomectomy, and this vaginal myomectomy, this is performed in case of a fibroid prolapse through the cervix. This is in case of the fibroid prolapse. So in terms of the fibroid prolapse, and this is through the cervix. Now let's look at some important devices. So some important identifications is the Boney's clamp. So how do you identify the Boney's clamp? So the structure is similar to that of a scissor. Then there's an interlocking, and there is a triangle, hollow triangle, which is present at the base. There is a handle here, and there is an interconnecting lock. There will be 4 hollow handle-like structures. So this will be the Boney's clamp. The other important thing to notice, there is a screw, and this is the myoma screw. So the myoma screw, how does it look? So there is a triangular hollow structure like a handle, and there is a straight, it is straight, and then comes a screw part. So this is nothing but the myoma screw.